And we want to discuss artificial intelligence and GI medical oncology. This is obviously an incredibly exciting time for the uses of artificial intelligence. Certainly, we've seen a ton of news articles about this with a lot of promising uses of artificial intelligence. But certainly, this has practical applications, maybe already in GI medical oncology. And we want to go through the top 5 uses of artificial intelligence in GI medical oncology coming up. So number 1, personalized treatment planning and treatment response prediction. When you think about designing a personalized treatment plan for our patients with any diagnosed with any GI cancer, artificial intelligence can come alongside physicians and potentially look at certain factors. What is their hereditary factors? What are their genetic makeup and mutations that are seen within a patient's tumor? What about the patient's performance status, their laboratory values? All of these factors are things that physicians and GI medical oncologists consider when personalizing a treatment plan for their patients. And you can imagine artificial intelligence coming alongside a GI medical oncologist and potentially looking at digitized, guidelines from the National Comprehensive Cancer Network, looking at all the data that's coming in and helping to develop a personalized treatment plan based off of all the factors. And as we all know, personalized therapy in every single tumor type is becoming increasingly complicated as more therapeutics are developed for specific alterations, for particular tumor makeup and genetic phenotypes. So given that, the ability of AI to be able to come in and help design a patient's treatment plan could be an incredible improvement in terms of guiding patient care. Number 2, early detection of cancer. We know that artificial intelligence is already making strides in terms of being able to diagnose cancers at an earlier stage. One of the best examples, even currently, is the use of artificial intelligence in looking at cervical cancer or the risk of developing cervical cancer. There was already a study done looking at visual inspection of the cervix versus Pap smear versus artificial intelligence's ability to be able to diagnose or predict the risk of cervical cancer. And what was amazing in this study was that artificial intelligence was able to outperform not only visual inspection, but Pap smear as well. And so, again, there's really emerging data on artificial intelligence's ability to collect data and be able to, number 1, estimate potential risk for cancer, but then number 2, sometimes diagnose cancer at an early stage. We're already seeing artificial intelligence being able to read pathology slides, be able to look at radiologic images. And again, this isn't really, I don't think the future is that artificial intelligence will be replacing physicians in these arenas, but really just coming alongside physicians to be able to better, risk predict, or in some cases, make an early diagnosis. Number 3, clinical trial design and patient selection. There are just thousands upon thousands of clinical trials that are exciting and clinical trials that we want to be offering patients who are diagnosed with cancer. Part of the issue when selecting clinical trials is knowledge of whether the clinical trial is even open. Number 2, if a clinical trial eligibility is met by the patient. And number 3, if the patient is obviously a good candidate for that clinical trial. This is an incredibly complex process, and many GI medical oncologists know that even the availability of slots on these clinical trials is sometimes a minute-to-minute or even hour-to-hour situation where the slot status may change. Artificial intelligence may be able to read the electronic medical record and have a repository of clinical trials that are available either within a hospital system or even a general area within the United States. And you can imagine artificial intelligence is now being able to read the patient's chart, to be able to start to connect a patient with available clinical trials based off of entered in eligibility criteria. You can imagine that this would be an incredible advance in terms of, number 1, offering patients the right trials at the right time, but then number 2, given how much time that this takes for study staff and GI medical oncologists, think about the ability of artificial intelligence to be able to do that work in a much more efficient way, with obviously requiring an up-to-date repository of clinical trials to be able to select, again, the right patient for the right trial. Number 4, risk stratification. When we think about artificial intelligence and our patients with diagnosed with any GI tumor, there are a couple things that the patients, I think, always ask about the moment they're diagnosed with any cancer. Number 1, what does prognosis look like? And certainly we have data from clinical trials, showing what prognosis might be like with treatment, as well as, what the risk of the disease is basically in general. But can artificial intelligence look at all the factors of a patient's not only physical characteristics, their laboratory values, their performance status, their exposure history, but also look at the genetic makeup of their tumor, look at hereditary factors, but also to be able to read things like their radiologic imaging and develop a predictive analysis of, well, this patient has these risk factors, so there may be at more risk for recurrence, they may be at more risk for treatment resistance. And some of these tools can be, number 1, very, very helpful for the patient, but number 2, could be very helpful for a GI medical oncologist in terms of, number 1, knowing what a patient's course is likely to be. And then number 2, especially in a surveillance setting, maybe a patient that might require more active or more frequent surveillance to look for cancer recurrence based off of an artificial intelligence algorithm that tells you that this patient is either low risk, intermediate risk, or at very, very high risk of having a cancer return. And number 5, big data analysis. Certainly, we live in an age where our patients have a ton of data that are available in the electronic medical record. We also have just incredible amounts of genomic information from all the sequencing of tumors that has been done and will be done in the future. It is really, really difficult, I think, for any researcher to be able to look at, thousands, if not millions, if not billions of data points and really look for pattern recognition, to look for factors that may be influencing a tumor and their response to therapy. Artificial intelligence has the ability to look at, incredible amounts of data and be able to develop, essentially questions. There is a pattern of these mutations with these physical characteristics that lead to this potential outcome in terms of a patient's tumor. So can artificial intelligence help us ask better questions by analyzing a ton of data points, either per patient or just to look at millions of patients and start to look at patterns that artificial intelligence is seeing so that we can start to ask the right research questions. And so, if there is a series of factors that appear to have, higher risk or maybe higher response to a particular treatment, we can start to design research studies or even clinical trials to help answer that question. And of course, artificial intelligence is never going to be always right, but it can start to help us look for potential patterns that we can then test.